Good afternoon. Here we are at the Provider Lounge at the 68th American Healthcare NCAL Annual Convention in Las Vegas, Nevada. Today we have Jim Gomez, President of the California Association of Healthcare Facilities. Welcome, Jim.
Welcome. It's a pleasure to be here.
Yeah, we're so happy to see you. And lots going on in California. It's a big state, and we've had a lot of discussion on five-star staffing and surveys, but specifically in California, you've had a recent regulatory or change that happened?
Yeah, we had a law change, and the law change, currently the law requires 3.2 nursing hours for every patient. So in a 100-bed facility, you got to have 320 nursing hours in a day. And the law just passed that makes that number 3.5, which means we're going to have more staffing in our nursing homes. It's going to be one of the highest standards in the nation. It also has a secondary standard, which is 2.4 CNAs, or Certified Nurse Assistants. We think the lower part of the standard is going to be difficult to meet because there's such a demand for certified nurse assistants. California average salary $14 an hour, competing with McDonald's and others that are paying $12 an hour. So our biggest issue will be over the next 18 months relative to that is can we train and maintain the certified nurse assistant workforce. We're already at 3.7 hours per client, but we're not at the 2.4. We have more RNs and LVNs than most states.
So this is interesting. So not all states have a staffing parameter.
That's correct.
And yours, you're saying you've had, but prior to this new ruling, which will go into effect next June?
Next July.
Next July, so July 1st. So by July 1st, they will have to have a 3.5 nursing hour PPD and a 2.4 certified nurse assistant. And tell us, for the states that don't have this said requirement, how do they know when they are not meeting that?
They come out and audit, and they take a look at 20 days, and if you fail on any one of those 20 days, you fail. So they do it at random, so you don't know which days of the year they're going to pick, and so they pick December 2nd, November 13th, January 1st, whatever they pick, and you have to demonstrate through your payroll that you have met those standards of 3.5 and 2.4.
So tell me, what do you do if you don't have the staff?
You do overtime, and you force overtime, and if you don't have that, you look at nurse registry in terms of hiring people on a registry, which is more expensive, and you typically don't get reimbursed for it, so it's a big challenge. So the real issue is, how can you maintain a workforce and not have turnover at the 60, 70%? You can get yourself down to 20 or 30%, your ability to retain staff. So once again, a good management, a good empowerment of staff, you get to keep more people. Bad management, pushing people out, not being sympathetic to individual needs, you may lose staff. And as that turnover takes place, turnover in any industry is a problem from a training standpoint.
100%. What are the ramifications, the CMPs or civil monetary penalties, if you do not meet the standard for the nursing hours?
Well, in California, the real the penalty could be as much as $15,000. But the real penalty is if you fail the test, you can't compete for a pot of money called QAS, the Quality and Supplemental Payment. It's $90 million that all facilities compete for, and the average facility that wins gets $250,000. If you fail this standard, you can't even compete. So you could be passing up $250,000 by not meeting the minimum standard.
How many nursing homes are in California?
1,150.
Okay.
85 did not meet the 3.2 standard last year.
Thank you.
The others all met the standard. And so now that it goes to 3.5, that number is probably going to go up a little because people have to go out and recruit and retain more staff.
And of the QAS, the funding, how many of eligible skilled nursing facilities receive money from that? Like, would 50%, 2%, what percent?
So about 40% receive of anywhere between 200 and 250,000, and another 10% improve significantly over the year prior, and they receive about 50,000. So as an example, if you were at the 30th percentile, if you go from 30 to 40, you'll get 50,000. If you're at the 50th percentile and you go to 60 percentile, you'll get 200,000. So
Wow.
it depends a little bit on where you're at.
That's amazing. Well, we're out of time, but this was a wonderful conversation. I'm sure the viewers are going to love to hear about what California is doing. We know that you're innovative and ahead of the curve in a lot of the areas, so thank you so much. And also, I heard that you're retiring, but you're not retiring. You're retiring from your current role, but you'll continue on in a consulting fashion.
Absolutely.
Which is great.
I've had 16 wonderful years with the California Association of Health Facilities, been a member of Mark Parkinson's team in the national level. I've enjoyed every single day of it, but everybody's time comes in life. My time is now, and I will move to consulting, but I'll still have a wonderful, wonderful fondness for the American healthcare and this whole profession.
Oh, thank you. We're blessed to have you as well. Thank you so much. Jim Gomez from California. Thank you so much.
Thank you.
Thanks for coming.